You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host, Dr. Mohan, your Chief Quality Officer and hospitalist by trade. Today, we'll talk about something that's very important to anybody receiving healthcare, costs. And to discuss that, we have a very special guest, Carolyn Abel, with us. And before we get into the service and product that we're going to talk about, I would like my guests to introduce themselves. So, Carolyn, take it away.
Thank you, Doctor. My name is Carolyn Abel. I'm the Vice President of Revenue Cycle for Mosaic Life Care. I have worked for Mosaic since June of 23. I came from Indiana, a very large shared service center there, managing Revenue Cycle for 26 hospitals. So lots of years in the healthcare business. So.
Excellent. Thank you for all the hard work that's gone into Revenue Cycle. And I can tell you from the caregiver side, at least the provider side, it's been a seamless process for us. So today we're talking about costs for high deductible or especially high costing services for patients. And one product is called MD Save. Is that right?
Correct. MD Save is a program that was really a solution that we were coming up with for our self-pay patients more than anything else. Mm-hmm. We are including some of our high deductible plans, but it's something that you're generally not expecting insurance to pay anything, so it's self-pay. And it's a way that Mosaic Life Care can pass on some of those discounts we give insurance companies also to our patients. So it's a prepay purchase voucher. Okay. It's basically a coupon type thing.
Okay, that makes sense.
Yeah. Basically, the physician may order some lab tests, radiology, whatever services, and you can go on the MD Save website, which there's a link on our Mosaic Life Care site, and look it up by the order of the physician, either by the name of the test or by the CPT code on the test, and it will give you the reduced price rate. It's substantially reduced, probably at least 75% in most cases.
Oh, wow.
So it's pretty substantially reduced. But you prepay for that voucher, and when you have your services, you tell us you have the voucher, we take your voucher in, and basically the charges are all the same, but once we redeem your voucher, we discount the difference.
Excellent.
And you're paid in full.
So can you give me an example of what type of these tests or procedures might include?
One that we did the other day was for a PET scan for a gentleman that his insurance wasn't going to pay for the PET scan. They didn't meet the criteria, but they wanted it done anyway. Mm-hmm. So it was going to be, I don't remember exactly, $6,000, $7,000, and we were able to reprice it at about $2,000. So they received the normal charge that they would normally get, but when they prepaid the voucher and we applied that, we discounted the difference for them. And it also includes any interpretation fees, professional fees associated to it, as well as the hospital charges.
Excellent. So down from $6,000 to $7,000 to $2,000, that's a bargain.
Yes.
Especially it's something that the insurance won't cover.
Right.
So how does exactly MD Save work? Like, I know you mentioned it's a coupon, but how does it really work in general? Because I feel like it doesn't sound like it's nobody's making money on this type of thing.
Well, we normally, most insurances get some substantial discounts from the hospital and in healthcare. It's pretty normal in our contracts. So this is just our way of being able to pass on some of the same types of savings to patients, because we're not going through normally what we have to go through with insurance, which is to submit the claim, we get a denial, we have to appeal the claim, send medical records, fight with the insurance, and It's months before we get anything back. And this way we just go straight through, and it's self-pay. We're able to pass on some of those savings to our patients, and they can receive their health care at a reasonable cost, and basically share that same discount we give others, like Medicare.
So it sounds like it saves us a lot of work on the back end from when the test or procedure is done, so we're not chasing those denials and doing all the back and forth. And I can tell you, as a provider, I've spent many hours just having those prior authorization conversations or denial appeals, and it's what I would call a job dissatisfier, but that's not just unique to me, it's across the whole country. Other ways that MD Save saves people money and work, can you give some examples of that?
As I mentioned, it's primarily on a self-pay basis, but there are some plans out there now that have $5,000 and $10,000 deductibles. And when we go through the MD Save route, we do not bill any insurance. So it would have to be, and we can't guarantee that the insurance would accept your receipt from paying MD Save as being part of your deductible. But you can always try that with your insurance. It will not work with government insurance, I can tell you that. But we can, if it's towards the end of your plan year and you know you're not going to meet your deductible, it's a good time to reconsider. Do you want to pay the higher rate? Because it's not a retrospective, it's a prepay program. Or do you want to go ahead and purchase a voucher in advance and look at the discounted rate?
And how much dollar amount can they pre-purchase? Or is there a set limit or not really?
There is a price set up in MD Save. It depends on the plan. For instance, we have OB care. And this would include all of your prenatal, postnatal care, delivery, anesthesia, all of the hospital services, and anything for your delivery, whether it's a C-section or vaginal, and it's one price.
And what about fertility?
Oh, that's our big one.
Really?
Fertility, yes. It was really gone over in our fertility clinic. So we have a lot of vouchers with the fertility. It gives them, those are usually self-pay.
Right.
And this allows them to purchase that voucher in advance and have their fertility treatments.
And sometimes they require multiple treatments. And
Absolutely.
if it's out of pocket, that cost can rise up pretty steadily for couples who are trying to have children. So by prepaying some of these costs, you're actually offsetting some of those end of the year costs, really.
Yeah, absolutely. And they can purchase those as they need them. So if they try it once and the fertility doesn't work and they need to do another one, then purchase another one. There's no limit on the number that you can do.
Oh, really?
And
There's no cap or dollar, like how many vouchers you can purchase for?
No limit on that. You can purchase as many as you want to. If you don't use it, you would work with MD Save directly to get a refund on that.
Okay. So if you don't use
if you don't use it, you can always go back and get MD Save and cash it back. And you need to look on their website on the details on that.
Sure.
But you can change those out, or if they change the tests they're going to be doing, our financial counselors can help you go on the website and adjust that for any different tests that you're going to have that maybe wasn't expected. Like the doctor may order an MRI without contrast, and we get to the hospital and we find out we need contrast. Is that a different price?
Probably is.
Our financial counselors can help you swap that out.
Oh, wow. And how fast is that turnaround time to swap them out?
However long it takes to log into the website and find your voucher number and switch it. It doesn't take that long, and we're happy to help with that.
Excellent. So let's say I purchased a voucher for an MRI. And I have it. And I show up to radiology. Do I bring the voucher with myself? Is it a QR code, or is it a physical piece of paper?
Well, you can print it on a piece of paper, or if you have your voucher number, that's fine. And just go to the registration area. We will log into MD Save and pull in your voucher, redeem it, and we'll have a insurance plan code we call MD Save, and it tells everybody that don't send a bill to the patient. We're vouchering this with MD Save. MD Save wires the money to us, and we discount the difference.
And it's all relatively quick?
It's all relatively quick. The money's wired within 4 days, and we usually have it all closed out within a week.
Are patients buying multiple vouchers at the beginning of the year to offset some of the costs later down the year? Are you seeing that trend, or...?
The program is so new at this point, I'm not really seeing that yet. It is just taking off. It's taken some time for us to come up with all of the different areas that we want to provide this for. For instance, not only are we doing fertility, we have lab tests. We have many radiology tests. We're doing it for physical therapy.
Really?
Yes, PT, OT, speech, all of those service lines. We have that available for them as well. We're doing it in our bariatric area as well.
And those can be quite high cost.
They can be very high cost. Yeah. And if we don't have something listed that a patient is looking for, you can talk to one of our financial counselors, and they'll reach out, and we'll probably be able to reprice it for you if it's otherwise eligible.
And what's the best way for someone who is entertaining getting a voucher for an upcoming test? MD Save or the financial counselors, or both?
They can talk to the financial counselors. They are versed on MD Save and should be offering that. We've also educated our pre-registration staff if they have a self-pay patient that is coming in for services to talk to them about the price of the care they're receiving, and perhaps even offer them MD Save and walk them through how to go online and purchase it themselves or help them do it.
So it sounds like the most value is for patients who are either self-pay or have high deductible plans. What about patients who have insurance? Can they still also purchase MD Save coupons?
We do not bill insurance if we're doing MD Save.
Gotcha.
Ever. And if it's covered under a government payer,
Medicare, Medicaid.
You can't do that at all. We need to go through the government payer and bill it that way. If it's not covered by them, we can have you sign a waiver stating that you know in advance it's not covered by them and you prefer to go through the MD Save. And in that case, we could offer the MD Save program then.
So it sounds like there is something for everybody regardless of what plan they have.
Absolutely. As long as it's going to be out of their pocket and self-pay, we can work with them on how best to work that out for them.
Excellent. What's the maximum amount of savings you have seen? I know you mentioned raw numbers from 7,000 to down to 2,000, but like, what are the biggest savings you've seen in procedures? And if you don't know that,
I couldn't really tell you. I know most of it runs about probably 50 to 75% savings on most items that I have looked at. Yeah. I certainly haven't looked at every single item myself and judged that, but basically it's really nice because normally you're going to have a bill from your physician, from if you're having surgery, your physician, any assisting physician, anesthesia, the hospital, and this wraps it all into one nice, neat package for you. And it pretty much caps it. Yeah. So it's one package price, and any of the difference is absorbed.
So how does MD Save make money? It sounds like they're brokers of discounts in a way. Do they get a percentage of the money saved, or how does that work?
There is a processing fee that is included in the price. So that is already built into the price, into the voucher when you purchase it.
But that is patient agnostic because the patients are still getting the benefits.
The patient's still getting the flat rate. And out of that, it's MD Save then sends the appropriate amount of money to each of the providers involved in the case. So if we've got anesthesia, a physician in the hospital, they'll send the 3 checks and for the correct amounts for each of those items.
Excellent. So outside of the money saving for the patient, what other benefits of reducing work for the patients have you seen? Is it less phone calls to insurance companies to fight for those tests, or?
Less phone calls, not having to worry about authorizations, fighting the claims, worrying about if they're not going to pay, am I going to end up with a huge bill on the other side that I don't have any idea how much it is.
Right.
And we cannot offer the discounts retrospectively. So you need to be able to do this in advance. It also offers a way that the patient can be a wise shopper. You always want to look before you buy and see how much you're going to be paying for services. And this allows you to know exactly what you're going to be paying for any particular service. And you can weigh your options then to see, is this more appropriate for me to be able to shop here and purchase that service? Or what would it cost if I just walk in and have it done? And we have price transparency on our website as well, so you can see what the normal price would be.
Right.
And then what your discounted price would be if you purchased in advance. Yeah. So it gives you a lot of opportunity to know what you're buying before you buy it.
Absolutely. And as patients are becoming more conscientious consumers of their healthcare journeys, I think this is a vital tool to let them know, like, this is the cost for the procedure or testing. This is how much it will be out of pocket without MD Save, and this will be with MD Save.
Absolutely. It lets them make their financial decisions for them instead of suddenly getting overwhelmed with huge bills on the back end and having no idea that they were coming.
I've had 3 children here in Mosaic, and I can tell you every price was different. Every
one of them are.
And I was like, okay, I guess this is how it is. But it's different when you're a caregiver for Mosaic versus when you're a patient from the community, so to say. So you mentioned something that's interesting, which is retrospectively. So what if I have a procedure scheduled, but I don't know about MD Save, but I just find out about it while I'm registering? Can I apply for it then? Or?
We can help you through it during the registration process, absolutely.
Oh, excellent.
Yeah. I had a couple of patients the other day that I saw some concerns come through about pricing. And because it's a brand new program, and they were pre-registered. We listened to the recording on the pre-registration, and they were not offered the MD Save. So we called the patients, even though they had already paid, and offered it to them, and actually refunded them the difference. So,
oh wow,
it's not something we'll normally do, but it's a new program, and I wanted to make sure that they were aware of this for future services that they might need because they were self-pay patients.
Right. So it's not retrospective, but for this patient, you kind of, since it's so new,
It's brand new. It wasn't offered by our caregiver, and it just rolled out so for that particular service. So we wanted to make sure they are aware, but we're trying really hard to get the word out to everyone, which is part of the reason we wanted to do this podcast with you.
Excellent. I appreciate it, and I'm learning as we're talking about it too, because it's so new. But it sounds like there's a tremendous value to be unlocked for the patient, because sometimes that's where the most benefits are with these new programs. And as good stewards of our community, it's good to offer those services or paying the benefit forward.
Right.
Can MD Save save the patient beyond the Mosaic's normal self-pay discount?
Absolutely. Our normal self-pay discount is 15%.
Oh, so regardless of MD Save or not, you get a 15%?
You get 15% regardless if you're self-pay. That's not on deductibles and copays. That's just pure self-pay, no insurance involved. But 15% is a lot less discount than what MD Save will get you. As I mentioned, MD Save is going to be 50 to 75% off the normal price, generally.
Wow. So if they're on top of the normal discounts Mosaic offers, this will be an additional benefit for them.
Well, it's one or the other. You don't get the self-pay discount and that because it's a packaged rate.
Gotcha.
When you receive health care, it's based off what is needed by the patient. So if, in the prior example of an MRI without contrast, so that particular patient comes in and they really need it with contrast. Mm-hmm. So the care you receive is based off of what you need. Deliveries might have more supplies for one patient than they do for another, and that's why the prices are different. But through MD Save, it's a package rate. So
I understand.
It's not going to waver. It's not going to change.
Oh, that's excellent. So what if the patient has a high deductible that would cause the insurance to not pay anything on the case, say for the PET scan you mentioned? Mm-hmm. What are they charged in that case?
The patient is always charged the normal charges that we charge anybody. We don't do pricing based on whether you have a particular insurance or you don't. We charge the same whether you have insurance or don't. But if you purchase the MD Save voucher, you get a discount applied on the back end. So if they have a large deductible, they know they're not going to meet their deductible and they just want to go ahead and pay for it and take advantage of the discounted rate, you can purchase a voucher and go in as self-pay. Some insurances may or may not allow you to send your receipt in to go towards your deductible.
Yeah, that's my next question.
That's between you and your insurance, and
okay.
We don't get involved in that. I can tell you government payers will not.
Okay, so if you're Medicare, Medicaid, or Medicare Advantage, sending a receipt in will not work.
I don't believe that will work. They'll want a claim filed to them, and if you've done MD Save, we don't file the insurance.
Okay.
And we probably will have a waiver signed in advance.
That's a good caveat to mention, because a lot of people might come out thinking, I have a voucher, but then they may not if they have one of those governmental programs, or if they have a receipt, just pre-check before them.
Right. And we can't guarantee any insurance will allow that. Most insurances will assign your deductible based off what your plan is, your particular plan, and they don't like us to discount those types of things. So
they're a business after all.
They're a business, and that's the deterrent from seeking care that you might not particularly need if it's your deductible meeting that first deductible. So if we start discounting that on a regular course of business, it's frowned upon.
I understand that completely. What if the service I need is not listed on MD Save with the CPT code or anything? What happens then?
Reach out to one of our financial counselors and give them the CPT code and ask them if this is something that can be added. And we will evaluate it as quickly as we can. Usually we can respond within a day or two and see if it otherwise qualifies and what that rate would be.
Okay, so if it's not on mdsave.com or CPT code, the financial counselor will definitely help you get it resolved.
Absolutely.
Or at least some information. So it sounds like the best benefit is if you have no insurance or are self-pay and you have a prepaid voucher from MD Save. But if you have insurance and you want to go through this, whether it's governmental or commercial, check with them if their rates would be covered or the MD Save would be covered. Is that right?
Yes, because we will not, as I mentioned, we do not file insurance if we do MD Save. So that is between you and your insurance company. And we cannot, you cannot personally file a government payer. So your Medicare and Medicaid would have to be filed by us. So if that's the direction you're going, we'll bill it. We're happy to do so. And we're happy to go over with you what your portion would be on that.
Yeah, so it sounds like if you have a test that is not part of your routine care, you're just curious about, say, a PET scan, you can choose your adventure, which is whether you want to go through the traditional route of your insurance and possibly deal with denials and months of haggling with them versus just prepaying a discounted rate through MD Save, which does not go through the normal channels of filing charges with insurance and then saving the money up front.
Correct. I mean, there are some things we're looking at. I think we're about to post our flu shots at a flat rate. And then there's some lab tests that even Medicare doesn't necessarily pay for if it doesn't meet certain criteria, but you may want to have it done.
What examples would those be?
I think sometimes PSAs that have certain diagnoses that aren't otherwise covered. There's most lab tests require certain diagnosis to justify medical necessity. But if you're wanting to get those done, just for your peace of mind, we can do a waiver, and making sure that you understand it's not a covered service and that you're electing to have it done anyway. And then we could go through the MD Safe route for you.
Right, and PSA for those who are listening is to check for prostate cancer.
Correct.
And sometimes just those values are not really reflective of if there's cancer or not. A lot of different things can cause it to be elevated. That's why the government says, you know what, that's not really the best test, so we're not going to pay for it.
Right.
And it's essentially what it is. So it sounds like this is a novel way of addressing disparities in our community for patients who are self-pay or have high deductible plans to choose a different route, but at a highly discounted way to get that testing done for themselves. Because unfortunately, we live in a society that medical care costs tremendous amount of money, regardless of any walks of life, and any discount that can be applied for these testing is welcomed.
Absolutely. Wise shoppers always look for those special coupons and discounts.
I don't disagree.
And this is a way our patients can do that as well.
Especially in this economic events that we're in, it's best to always be a conscientious shopper, and every dollar goes a long way.
Absolutely.
Lord knows the inflation is not helping any bit. But let's digress a little bit further. Anything else you would like our listeners to know about MD Save, or how they can get more information about it?
There's a link on our website to MD Save, or you can go to mdsave.com, and you can research there. Has all the information, options. If you have insurance and think you want to try and have the voucher applied towards your deductible, what you would have to do are ways you can do it. We won't do that for you.
Okay.
We can't, and we can't bill your insurance if we do MD Save. But you can investigate in advance and just be a wise shopper. See what the prices are. MD Save is all around the country. I used to use it at my prior place in Indiana. And you can basically shop pricing through it for a lot of different places. I'm not aware of too many in this area that have it, but it is something we're adopting for our Mosaic Life Care patients.
And that's very welcome, because a conscientious shopper is a better shopper in the long run, and any savings we have that we can pass on to the consumer gives them tremendous power over how they address their healthcare journey. So
absolutely.
Thank you, Carolyn, for taking the time. mdsave.com is the website, and links will be provided on this podcast when it's released. If you have any questions, you can reach out to Carolyn Abel or any of the financial counselors who are well versed in this topic. And if you are a conscientious consumer who is looking to get a better pricing or better understanding of how the testing pricing will be different for you, please go to mdsave.com. Carolyn, I want to thank you for taking the time.
Thank you.
And for all the listeners out there, take care, brush your hair.